Hey, Alphaness is Licensure from alphanessguide.com. This is bipolar disorder questions. Without delay, let's get started.
A client states to a nurse, "Hey, sweetie, you're looking good today." Which of the following responses by the nurse is best? 1. Thank you for being so kind and thoughtful. 2. I know you are only teasing me. 3. My name is Molly and I am a nurse on a unit today. 4. I am not here to receive compliments from clients. The correct answer is 3. The nurse states her identity and purpose for being on the unit to clarify any misperception by the client. Thank you for being so kind. I know you are only teasing me, and I am not here to receive compliment from clients are non-therapeutic statements and do not clarify the nurse's identity and purpose. The client with acute mania has been admitted to the inpatient unit voluntarily. The nurse approaches the client with medication to be taken orally as prescribed by the primary health care provider. The client states, "I don't need that stuff," which response by the nurse is best. 1. You can't refuse to take this medication. 2. If you don't take it orally, I'll give you a shot. 3. The medication will help you feel calmer. 4. I'll get you some written information about the medication. The correct answer is 3. The nurse should first attempt a collaborative approach to increasing adherence to prescribed medication regimen. Giving written medication information to a client with acute mania is poor nursing judgment, because a client with acute mania cannot benefit from written information as a result of impaired ability to focus and concentrate. A healthcare provider has prescribed valproic acid for a client with bipolar disorder who has achieved limited success with lithium carbonate. The nurse should instruct the client about which of the following? 1. Follow-up blood tests are necessary while on this medication. 2. The extended release tablet can be crushed if necessary for ease of swallowing. 3. Tachycardia and upset stomach are common side effects. 4. Consumption of a moderate amount of alcohol is safe if the medication is taken in the morning. The correct answer is 1. Valproic acid can cause hepatotoxicity, so regular liver function tests are needed. Other side effects include nausea and drowsiness. Extended release tablets should not be split or crushed. Doing so changes their absorption. Alcohol should never be mixed with this medication. There will be medication in the client's body at all times. A client has just been admitted to the hospital for medication adjustment after outpatient treatment failure of his bipolar disorder and returning mania. He tells his primary nurse about his medications and treatment. Which of his following statements would raise the most urgent need for more medication instruction about his lithium therapy? 1. My doctor tells me that my lithium level is 1.0, so I don't have to worry about my levels. 2. I've been getting a lot of good exercise playing on a local soccer team. 3. I'm trying hard to watch my diet and eat healthy. 4. I have learned to take my lithium even when I'm not feeling well, like when I had the stomach flu. The correct answer is 4. The therapeutic serum level for lithium is 0.6 to 1.2 milliequivalents per liter. Levels do fluctuate with fluid intake and output, however. Therefore, the most urgent matter for teaching is the client's comment about taking his lithium during excessive loss of fluids during an episode of stomach flu with diarrhea. Exercising is only concerning if the client becomes dehydrated. A healthy diet is indicated while taking lithium. A client comes to mental health clinic saying that he feels so down and lacking in energy with loss of interest in everything. He tells the nurse that he received some samples of a new medication from his primary care physician last week to relieve his depression. The nurse recalls that this client has a history of bipolar 1 disorder with hospitalization for a significant manic episode. With this knowledge, the nurse would have special concern if he is taking which of the following categories of medication? 1. Atypical antipsychotics. 2. Mood stabilizers / animatics. 3. Anti-anxiety agents. 4. Selective serotonin reuptake inhibitor antidepressant. The correct answer is 4. The most urgent consideration for intervention and for teaching is the fact that for individuals with a history of bipolar disorder Antidepressants, when taken alone, can push the person into mania. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern. Individuals with bipolar disorder are typically treated with mood stabilizers, and benzodiazepines are sometimes used in the short term to give a client relief before the mood stabilizers can take effect. A client with acute mania fails to respond to a nurse's interventions to decrease his agitation. The nurse has attempted to defuse the client's anger, but the client refuses to participate in interventions that would lower anxiety. Which action should the nurse take next? 1. Seclude the client. 2. Restrain the client. 3. Medicate the client. 4. Control the client. The correct answer is 3. The nurse should medicate the client who does not respond to verbal interventions and whose anxiety is escalating. This will reduce the client's anxiety and agitation and prevent harm or injury to the client and others. Seclusion, restraint, and controlling the client are a last resort and require a primary health care provider prescription and close assessment for when the prescriptions can be discontinued. A nurse observes a male client who is hyperactive and intrusive, sitting very close to a female client with his arm around her shoulders. The nurse hears the male client tell an inappropriate joke. The nurse approaches the client and asks him to walk down the hallway. Which of the following statements by the nurse should benefit the client? 1. She will not want to be around you with that kind of talk. 2. Telling inappropriate jokes and touching others is not permitted here. 3. You need to be careful about what you say to other people. 4. I think a timeout in your room would be appropriate now. The correct answer is 2. The nurse clearly informs the client about behavior that is unacceptable on the unit, such as voicing inappropriate jokes and touching others. Setting limits on behavior provides safety and security to the client and conveys to the client that he is worthy of help. Saying, she will not want to be around you with that kind of talk, and you need to be careful about what you say to others, does not clearly inform the client about behaviors that are unacceptable and implies that the client can control behaviors if he chooses. A timeout in the client's room does not inform the client about the inappropriateness of his behaviors and could be interpreted by the client as punitive as well as diminishing his self-esteem. A young adult client diagnosed with bipolar disorder has been managing the disorder effectively with medication and treatment for several years. The client suddenly becomes manic. The nurse reviews the client's medication record. Which of the following medications may have contributed to the development of his manic state? 1. Amitriptyline. 2. Prednisone. 3. Buspirone. 4. Gabapentin. The correct answer is 2. The use of prednisone or other steroids can initiate a manic state in a bipolar client, even if he is well controlled on medication. The other medications would decrease the client's depression, mood swings, and anxiety, making him calmer rather than more agitated. A young woman comes to the mental health clinic for her routine medication follow-up. She has been married for 2 years and reports that she and her husband are ready to start a family. She has a diagnosis of bipolar I disorder and has been well managed on D-valproic sodium, Depakote, for at least 3 years. What is the most essential counsel for the nurse to give her? 1. Schedule an appointment for a complete gynecological exam if you have not had one in the past year. 2. Pay careful attention to eating healthy from this point on in order to maximize the health of both mother and baby. 3. Check with your prescriber today as Depakote carries an increased risk for birth defects, especially during the first 3 months of pregnancy. 4. It is very important for you to take steps to reduce your stress, and this will help you to stay in balance during your pregnancy and reduce your chances of developing postpartum depression. The correct answer is 3. All of these options need to be addressed. However, it is vital that this young woman receive counseling about the serious birth defects that have an increased incidence with the taking of Depakote during the first trimester of pregnancy. These problems include craniofacial abnormalities, organ malformations, limb deficiencies, and developmental delays. The chances of preeclampsia and premature labor are also increased. In a pre-discharge program to educate clients with bipolar disorder and their family members, The nurse emphasizes that the most significant indicators for the onset of relapse include which of the following symptoms? 1. A sense of pleasure and motivation for new endeavors. 2. Decreased need for sleep and racing thoughts. 3. Self-concern about increase in energy. 4. Leaving a good job to start a new business. The correct answer is 2. Decreased need for sleep and racing thoughts are the most prominent hallmarks of mania. Feelings of pleasure, motivation, and increased energy within reason are desired experiences. Also, leaving a job to start a new business is not, in itself, a sign of impending illness.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.